for my time and presentation, here are the things that I'd like to achieve. Just a very brief review of kind of past recommendations. So this is really the fourth meeting of this organization on antimicrobial resistance. What's really different today? What brings us together? The landscape has changed rather dramatically, and I think it really gives us a great opportunity in addition to this idea of stewardship, which we're going to talk about a lot over the next 2 days. I'm going to highlight the report from the President's Council of Advisors of Science and Technology that was combating antimicrobial resistance, because it does now represent a framework, a national framework with agriculture front and center in this framework, and I want to highlight what that report is and how we should be a part of that. Discuss new opportunities for animal agriculture, and just a little bit on the critical shifts that when we kind of started 3 years ago talking about that to where we are today, and then kind of end up with suggesting some key themes for NIAA to kind of focus the dialogue in these small kind of work groups that's been characteristic of this organization, and really stress actionable ideas. So Dr. Braden already talked about the crisis at hand, and certainly in human health, it is indeed a crisis. The evolution of antibiotic resistance occurring at an alarming rate, outpacing the development of new countermeasures capable of thwarting infections in humans. This situation really threatens patient care, economic growth, public health, agriculture, economic security, and national security. I think that is the definition of a crisis. And if you just look at the cost in healthcare for antimicrobial resistance, this is what's been estimated at $20 to $35 billion, $35 billion loss of productivity, 8 million extra days of hospitalization, emerging infectious bacterial diseases becoming untreatable, 2 million illnesses, and 23,000 deaths. And it gets worse as we go. So also CDC has estimated that between 30 and 50% of all antibiotics prescribed for US patients may not be needed or optimally used. So this misuse or overuse, depending, is a major contributor to antimicrobial resistance, but it's only one of the contributors. And if you look at the situation globally, so why we have a tremendous problem ahead of us in the United States, think what's going to happen in the developing world. Think what happens when we all of a sudden raise 20 billion more food animals internationally to feed 7 to 9 billion people, and the ability to do that overseas, where we lack kind of basic health care and infrastructure, where we have low rates of vaccination in these herds and flocks, inadequate clean water, indiscriminate use of over-the-counter drugs, substandard qualities and even counterfeit drugs being distributed, and limited availability of newer drugs, which is all of our problems, right? And a real shortage of trained people. So I think this is an emerging crisis internationally, and especially in animal agriculture. So it's something that we want to pay attention to as we go forward. So in animal health, we know that there's extensive use of antibiotics to treat and prevent disease and also to promote growth. And these practices produce antibiotic resistance. Any use of antibiotics produce resistance. They do it for animals and through a variety of mechanisms that Chris kind of talked about. We certainly know that they can and do spread to people. If you look at what's happening kind of in healthcare and what the response is, and I would say it was in FY14 that federal spending on antibiotic resistance was estimated to be $450 million. Now, if this is truly the crisis that we just defined, that means that $1.40 per person per year is being spent on this problem. And I would suggest that that is an investment that's not commensurate with the level of this problem and the severity of it. And that has to change as well. And this is the world that we don't want to enter into. 70 years the use of antibiotics, right? And if we can't cooperate and bring about, I think, new strategies, can we actually then develop and live in a post-antibiotic era? And that's what we don't want to ever have happen to us. So just real quick to go backwards and look at 3 years ago when this group first really started talking about antibiotic use in food animals. All of these had nice white papers, and I won't go through in lots of detail because you could review those, and many people here were at those meetings. But that first discussion really talked about the complexity and the multifaceted issues that were involved in this issue. that we have to have appropriate use, both in animal health and human health. The topic is more than science. It has to do with politics. It has to do with socioeconomics. It has to do with emotions. And there's a lot of issues tied together in antimicrobial resistance. The difficulty in measuring attributable risk becomes a focus of why we shouldn't do something as opposed to why we should. And policies has to be science-based and really wait and look at costs and benefits. Good husbandry practices are always important. And that dialogue was really started then about healthy people, healthy animals, and how that impacts and creates healthier food. We moved into the next year, and that was actually in Columbus. We talked about One Health and antimicrobial resistance. And again, the stress from that meeting was the incorporation of these multifaceted different segments of understanding antimicrobial resistance, starting with the end in mind, and that really was the improvement of human and animal health is what the outcome that we all are moving toward. We need to focus on interest and not positions. If we put positions forward, then you really can't create common interests. The One Health mindset is really important, and it continues to be important today, and I think in the dialogue this next day and a half while we're all together. It's about what's happening in people, what's happening in animals, what's happening in the environment, and that interconnection of those domains and how important it is not only for the understanding of antimicrobial resistance, but really to forge worthwhile kinds of plans to go forward and to have concrete measures and goals. And then last year it was really about a discussion bridging the gap between animal and human health. That continues, I think, especially during this meeting. And again, we talked about the science of antimicrobial resistance and the gaps of things that we don't know, that we need new tools, there's no question about that, that a broad representation of multiple stakeholders is important. And my compliments to NIAA in particular for bringing different stakeholders together, especially from our public health community, to be part of this meeting. It's an important part of our dialogue, it's an important part of what we do, and I think we do learn from each other. So my compliments to the organization. So we need to be open for dialogue and change. We need to enforce current regulations, we know that, and if we don't, there's a lot of potential favorable outcomes that we're responsible for. And then at the end of that meeting, the discussion was about collaboration amongst the three sectors, if you will, of One Health. So that brings us into today's meeting. So if you look back over the last three meetings, it really talked about kind of overarching themes of the complexity of antimicrobial resistance and difficult to get our arms around. The dialogues are certainly important, but really they lack actionable steps. And having a complex topic doesn't mean then that we can't build consensus. And antimicrobial resistance is a topic that includes multi-facets from science to politics to values, which is true, but that can't serve as an excuse for inaction. And that collaboration and One Health are necessary, also true, but we have to have follow-up. And the communication strategies, research, education are needed, also true, and there are varying levels of success and adoption. And all of you have been involved in this, I think, in many different ways, and my compliments for what has been, I think, been successful to this point, but we have lots of things to do. So what is this changing landscape? Why is it different today as opposed to the other three times that we got together? Well, it's about phasing out the use of biologically significant antimicrobials for growth promotion and feed efficiency, first and foremost. It's about the issuance of FDA guidances and the 3-year voluntary commitment from drug manufacturers that were pretty much a consensus. A shift from looking at over-the-counter products to put in feed and water to more prescriptions under the veterinary feed directive and certainly more veterinary oversight. And then the shift especially toward prevention and to stewardship programs, which is really the focus in part of our next 2 days together. So that's kind of where we brought together. And you'll hear probably other definitions of stewardship, but here's one that I think that makes sense to me when we're talking about antimicrobial resistance. Stewardship is a commitment to always use antibiotics only when necessary, to prevent or treat disease, to choose the right antibiotic, administer them with the right dose for the right period of time at the right route of administration in every case we use them. So that is the essence of stewardship. And that can be in a farm, it can be in a hospital, it can be in a veterinary office, it doesn't matter. That's the essence, for me, of what stewardship really means. And if you really look, especially in human health and in hospitals that have incorporated really good stewardship programs, there's no question that they've been effective. They have improved results and they've reduced healthcare costs. So I always think that it really is about being evidence-based. And I think we'll hear from some of the physicians at our meeting about where this has worked and what makes it work. So the new landscape then offers us new opportunities as we get together for this fourth symposium from NIAA. And we know about the guidances and the changes, and that's going to have significant changes on our farms, the response of pharmaceutical companies, and in just a minute I'm going to talk about this PCAST report and the essence of what I believe is a national framework, and a national framework of which animal agriculture is front and center, a critical part of its success, and it's understanding how we integrate our actions into that framework. And then recognize that resources will be necessary. If we're going to spend $450 million as a nation over the next 5 years for this problem, I don't think any of this can be achieved. And I'll just be frank about it. Either we step up, we, the collective we, and actually fund some of these things, or we really aren't going to get them done. And the focus from this day forward is about the future. It's not about what happened in the past, who was right, who was wrong, etc. It is about from this day forward. And that focus on the future is really going to, I think, result into some key activities and actions. So we recognize the cost of healthcare is a real urgency to push forward this emphasis on stewardship, which is really personal accountability, the positive, and I stress, the positive and essential role for animal agriculture as part of a national conversation and national strategy. It's not about us talking together amongst ourselves. It's a new opening and a new beginning, really, for us to be recognized and be a full strategic partner as we move ahead. And this consensus building, I think, becomes the new cornerstone, and these are the kinds of meetings and conversations that will really launch us ahead. And we have to really think about a bias toward actions and measurable results. I'm not going to do that. It looked good last night, didn't look very good today. So let me just really kind of briefly talk about the President's Council of Advisors on Science and Technology. This is a group out of the White House that advises the President about science and technology, makes recommendations to the White House on a full range of issues, of which antimicrobial resistance was one. So science and the technology appointed a committee, and that committee then put together a national strategy. So I happened to be a part of that group. And this recommendations to combat antimicrobial resistance was sent to the President, to the White House, to his advisors, and from that, an executive order was issued that all these recommendations should be implemented. So I think I just want to spend a few minutes on each one of these to point out what the national strategy looks like and how important it is for everybody to kind of pull together and do his or her part. So these are the 8 recommendations that have come forward from that report. So first, international cooperation. So we know that what we do in the United States is only part of this correcting this crisis, if you will. It is really an amazing international problem. We have to vigorously support WHO in terms of global action plan. In terms of animal agriculture, we have to work with the OIE and FAO in terms of their plans. And if you just think about the FAO report that came out a few years ago about Livestock 2020, that suggested that we have to have 50% more food animals being raised in the next 15 years in order to actually come close to the demand for animals of protein. You can see how this is going to really increase the need for antimicrobial resistant strategies. And that the global health security agenda, which was a major kind of policy issue that came forward with 30 different countries, also included a section on antimicrobial resistance. So getting back now, federal investment and leadership. There's no question with the complex strategies that have come out of this national plan that there has to have a national leader, a director, if you will, of oversight and coordination to put all the moving pieces together into a strategy, somebody that gets up every morning and says, this is my job to make sure that these strategies work and this framework actually can be completed. There'll be an establishment of an interagency task force of combating antimicrobial resistance bacteria, and I know the federal agencies, and you're going to hear from them, have already done a lot in kind of preparing for this time. And also establish a non-governmental advisory council to advise this group, create this national plan of action, and to fund it sufficiently. And every one of the recommendations that came from this plan has a funding component on it. So we know that it doesn't work. So leadership is absolutely critical as we move forward. That there's surveillance and response capability, not what it should be in human health and not what it should be in animal health. So without situation awareness, we really can't put together a strategy and measure what the outcomes are. So the US really has lacked a comprehensive monitoring system, and especially lacked a system that's coordinated across these different domains. That we use new genomic analytic tools to add capacity, that we have to include animal health when we talk, and the environment, when we talk about surveillance. It just can't be human health. We have to strengthen state and local departments to improve detection, response, and prevention. And we know that over the last years since the recession of how much those organizations have been hurt. And we need a national network of diagnostic labs. We have some of that, but this is a strategy that actually pulls together and uses data analytics so we can gather the critical data that we need. So stewardship in human health. And I'm not going to spend a lot of time in this because you're going to hear about this, but just so you know that is a key part of a national plan of what we do in hospitals, the use of vaccines and alternatives are necessary, what Medicare and Medicaid should do for reimbursement incentives, and to create a special $25 million prize for innovative diagnostic tool. And that was also already put forward. So you're going to hear about stewardship, I think, and I'm going to let our colleagues that talks about human medicine go into those. The other is commercial development. So we have been using antibiotics for 70 years. Over the last 30 years, the pipeline for new antibiotics have been amazingly dry. So there's a real scientific challenge in that discovery and development of new antibiotics. And there's been a lack of economic incentives. Certainly, if you look at a business plan to spend $800 million to $1 billion per product, it looks to, I think, a lot of pharmaceutical companies that it really doesn't have the return on investment that's necessary. So we need to change that strategy by looking at public-private kinds of partnerships, perhaps federal funds to advance early stages of R&D and share that with companies and corporations, to create an antibiotic incentive fund. So if it costs $800 million to $1 billion per product to actually go through the approval process, should this be available for companies? And then to actually look at ways of kind of pull strategies and push strategies. And one is to be able to delink the usage with the revenues. So if it's really necessary to have a new antibiotic, then we need to have strategies and incentives that don't look at just the return on investment, but the ability to have antibiotics available. And that's going to take a whole new strategy. Or we may want to push patents and fees and those kinds of things. But these companies need to have incentives to move forward. So new antibiotics are absolutely critical. And we have to increase the rate at which these antibiotics are developed, or new interventions are discovered as well. A key part of the national plan. So we need to create a national infrastructure to support clinical trials with new antibiotics. So this kind of a robust infrastructure then is needed in order to accelerate the approval of these different drugs, and also to think about developing new regulatory pathways that can be done more quickly so that products are certainly safe and efficacious, but they're approved more quickly through special medical use pathways, et cetera, to get them into the marketplace much quicker. So fundamental research is another part of this. So what are the critical missing gaps? We have those in animal agriculture, we have those in a lack of understanding about how resistance takes place, how genes are passed. So we need to really expand our fundamental research relevant to developing new antibiotics and also alternatives. And in this PCAST report, there really does stress the idea of looking for alternatives to antibiotics in agriculture. I think it is a major research agenda that will move forward in the agricultural communities in order to do this. Establish a USDA multidisciplinary innovation fund. That actually was in budget but it hasn't been funded. But it's the idea of public-private partnerships, innovation, creativity, as we're looking to develop new antimicrobials. Funds, actions, and metrics of success have to be part of a distinct portfolio. We can't just add this to what we're doing. So if this is as important as we say it is, it needs a distinct portfolio of actions, a national plan, and research and funds to do it. And without that, why funds can disappear into other areas. And then the stewardship in animal agriculture, and we're going to be talking about that, and so I'm not going to go into lots of details about that, but promoting vaccine use, new stewardship programs on farms, how do we increase veterinary oversight in a way that's productive to producers, filling gaps in terms of stewardship programs, et cetera. So those are really the 8 parts of a national plan. And this doesn't work unless each one of those parts is fulfilled. And throughout that report, agriculture comes forward as a key component for a national strategy. It's not an afterthought. It's about being a strategic, full partner in the process. So the president signed an executive order to actually implement all these 8 strategies. And he's putting together then a task force that will submit a report back with that implementation strategy on a national plan next year, hopefully early next year, with his non-government advisory group and the parts of that plan that stresses diagnostics and new antibiotics, et cetera, new interventions. So it's the first time that I've seen this kind of national strategy that hits all of these segments pulled together into an integrated event. So for us in animal agriculture, it is a key opportunity. It is a key opportunity. So if you look at that support or this report, just looking at animal agriculture. So I picked pieces of this report out that had to do just with animal agriculture. It talks about supporting the new FDA guides and the veterinary feed directive changes. Talked about developing and implementing effective stewardship programs for not only food animals, but companion animals as a key part of that. We'll be talking about that for the next 2 days. To create and deliver educational programs, part of what we do from this organization. Establish a research portfolio and an integrated part of this agenda. Approve surveillance, response, and prevention. Look at public-private partnerships for new innovation centers. Coordinate our actions in animal agriculture with government agencies and state agencies, and then also help with the international groups. So this is also an emphasis of what we do on farms in terms of sanitation and hygiene and prevention, to incorporate diagnostic work with public health, to improve our infrastructures, to advocate new antibiotic development, to make sure that our plans have metrics, and to make sure that we are active participants as strategic partners in developing this as we go forward. So if this is a new day dawning, then let's take a look and get off the freeway, if you will, and the next exit's the future. And I'm going to kind of end with kind of a more future look of things that I think NIAA could do and its membership. So there's no question that FDA's actions are a game changer. And a game changer by definition means that old rules and actions may no longer be relevant or effective. So that means that we sit together for the next 2 days and talk about creatively, I think, inventing a new future. So guidances and change to the veterinary feed directive, and these guidances will mean a real change for how antibiotics are used on the farms and how veterinarians are involved. And that is a direct quote, and I should have put it in quotes from pork producers, and Liz, that actually came from you. So it really is true that there is going to be some real changes on the farm and with veterinarians and that relationship. And so, you know, I don't see this as a loss at all. I think these actions, while challenging, are just challenging, and we can actually come up with good strategies. What's really a loss to producers, I think, would be not having antibiotics available for serious disease problems. And this plan says they're still available. And true loss would be not having effective antibiotics when we really need them, and we can't live with that. So this strategy can put together, and we can actually still do this. So this is one of my favorite cartoons, and the guy says to his cat, "Never ever think out of the box." Well, this is just the opposite. This is your next 2 days of thinking strategically, thinking out of the box, and I think in a different ways. So there's some key strategies to this organization. And if you look at the mission for NIAA, it's information, education, and I'm going to underline and put in bold print, solutions. So this is not about conversation. It's about developing actually solutions. It's attacking these wicked problems that don't have yes and no answers, that are difficult for sure, but certainly with our ingenuity, we can come up with the results. That polarization about antimicrobial resistance will continue. I believe that's true. But you know, polarization will not result into viable solutions and actions. It just results in polarization. So we need to understand that we work from the middle and how we actually achieve common interests together. So this landscape has changed. It's certainly a challenge. The PCAST report really brings forward an integrated strategy that we're invited to be a part of. That strategy won't work without our participation. Further strategies, I think, and challenges is that the national plan acknowledges and encourages animal agriculture leadership and collaboration. It doesn't just kind of put it in as an afterthought. We're actually part of this in a major way. We have to work with WHO and CDC, who've characterized this problem as a crisis. Individual action is a key, I think, to collective action. And this animal health, public health interface is accelerating, it's intensifying as a global phenomenon, and this interconnectedness of animals, people, products, food, and our lives, right, has to be recognized and incorporated into future actions in the solution. So we can't move forward unless that interface actually understands and moves together. So I'm going to just move on a couple of these. So as I kind of think about this in terms and kind of explain it to other people, you know, to me it makes sense that this idea of resolving antimicrobial resistance is similar to what we're trying to do in the energy crisis. You know, that's been pretty acceptable, if you think about it. It still has polarization in terms of issues, but it's been relatively acceptable. So antibiotics represent, I think, a limited, finite, valuable resource to be conserved, and for which new sources need to be identified and all need to be judiciously used. So that's energy, that's antibiotics. Both challenges are spawned by our growing interconnectivity and the accelerated scale of human activity. And that's going to increase in terms of acceleration, which means a crisis is going to get worse. And seemingly, in terms of energy, rational short-term behavior really has long-term negative consequences that we don't see at the time. And I think that's also analogous to antimicrobial use. And individual actions and accountability are key to the ultimate solution in the collective response. And that's true in energy, and I think it's true in this topic as well. So for me, there's some exciting new possibilities. And that's what we're going to talk about these next couple days. So breaking the impasse. So this impasse of kind of talking about this and not agreeing with studies and not moving forward, I think, in ways that we could and should, means that we now have the opportunity for these consensual approaches. And that's why we have colleagues from CDC and public health and environment and other groups now joining us as part of that discussion, which actually is part of the strategy of this organization. So there's a great book by a guy named Bossity, and this book is called Execution. And he believes that without execution, you can't go from aspiration to actual action. And the biggest problem in terms of organizations, this is private-public, if you will, is the inability, really, to take our ideas and turn them into actions. And he says execution is about the right people, having the right processes and the right strategies, and not passing on that responsibility. You have to do it yourself. So execution is absolutely key. And NIAA is a community of practice. How many people have heard the term community of practice? So I involved in a community of practice in veterinary medical education. And I'm going to mention this in closing. That's exactly what I think this organization is becoming. And on this topic, it's really critical. It's how we learn from each other. And this is a community of practitioners, all involved in a personal basis or their organizations, and I'll mention that in a little bit. That stewardship for me is a new language of accountability and action, and it's about individual responsibility. We need to embrace a national plan and accept the responsibility for action and change. That's a great opportunity ahead of us. One Health continues to be an appropriate framework and developing this common ground or interest. So not accepting inaction as a viable solution in the face of a worsening crisis. So I wouldn't want to come to this meeting a year from now and say we just are continuing with the dialogue. The dialogue is important as long as it leads to action. So taking action with imperfect or incomplete data is about doing, learning, and adapting, and they have to be done concurrently. So don't take the strategies of what our universities do, and that's more committees, more studies, and more reports. This is about moving ahead without all of the answers and finding the answers as we do it. We've done that before, and we'll continue to do it. Leveraging the unique attributes of this organization, whose mission and membership is about common interest in catalyzing action. That's what NIAA is all about. And I think it's great that this organization would grab a hold of these difficult topics and move them ahead. And then reconciling is what's known as the knowing-doing gap. So how complex and difficult problems can still be resolved. And that's how organizations, people, universities, government agencies, private companies can actually shift from what they know to what they can do. So we'll kind of end with those. The communities of practice. So think of yourself in these next 2 days as communities of practice. Are groups of people who share a concern or passion for something they do and learn how to do it better as they interact regularly. Right? How to do it better as they interact regularly. And the elements of communities of practice are a domain. In this domain, it's antimicrobial resistance. The community is about building relationships and learning from each other. We've already talked about to bring different voices in. And the practice, they're all practitioners. And that brings then a community of practice, which is really important as we learn and move forward. Stewardship is changing the conversation. It's an emphasis on individual responsibilities and actions. It's not about regulation, it's about accountability. It's eminently actionable. We can design them, we can do them, and they can make a difference. They're proven to be effective, and there's evidence-based that prove that. They're based on scientific principles, but there's flexibility in implementation, and individual actions are the collective drive and the change for the ultimate outcome. One Health is important as these domains of animals, people, and the environment move together, and so is strategies for antimicrobial resistance, that we don't worry about what's on the sides in terms of conversations that aren't very productive. They occur, they're part of our world. What we do is we go from the middle. So this old Gaussian distribution is interests are two standard deviations, and that's where the solutions come from. It doesn't come from the ends. So the knowing-doing gap, as we kind of close this conversation, for me is something that I've learned is absolutely critical, right? So when knowledge of what needs to be done fails to result in inappropriate action or behavior change, that's a gap between what we know and what we do. And how do you know you're in that gap? You know because if talks, decisions, plans, documents substitute for action. We can dust off a nice glossy report, we've kind of checked it off, we've done it, and another year goes by and we say to do it again. That's a knowing-doing gap. When memory substitutes for new thinking, about this is the way we used to do it, it should work now, that's a substitute for new thinking. And where fear prevents action. So what we really need to do is to think about why before how. So why are we doing this? Why is it important to animal agriculture? That drives the doing. Knowing comes from doing. Mistakes have to be tolerated and will be made. We measure what truly matters, and we have to have strong leadership. Okay? And these last two slides. So I started out of private practice in North Georgia on accelerated brucellosis campaign. And I had 27 counties in North Georgia with hundreds of reactors. And it was the idea of how do you actually eliminate brucellosis from the US herds. And many thought that that could not be done. Actually, when I was in North Georgia, I wondered if I could do it myself. We actually got it done. And why this is not the same as our problems with antimicrobial resistance, some of the ways we did it are. There was a sense of urgency about the profound health problems and substantial economic losses. That could be TB, pseudorabies, Salmonella enteritidis. Think about the things that we've done together, right? There was a national comprehensive plan that was accepted. We now have a national plan. There was collaboration, state-federal. That was a state-federal system. It had producers involved. It had universities doing research. Public health was involved. Legislators. The same thing we need now. Research with ongoing programmatic adjustments. So we did research as we actually did the campaign. And we changed based on what we learned. We didn't wait on what we learned. And we learned and improved through experience and actions. That was typical of what needed to be done. And resources were appropriated, right? And then we learned that surveillance was key. If we didn't know where we were, the old adage, if you don't know where you're going, any road will get you there. So great surveillance was absolutely critical. That was the essence of eradication programs that were successful. And the principles, while this is a different problem, right, still, I think, are what animal agriculture has done and will continue to do. I'm going to end with this slide because when you get gray, you can do these things. There's a great book. It's called Too Soon Old and Too Late Smart. So when all is said and done, more always gets said than done. So this isn't about just talking more. It's about having our conversation, but it is about acting. And I really like the idea that pessimists seldom are disappointed. I would be enormously disappointed in myself and people in this room if we didn't have the optimism to actually know that we can be successful, right? We can. No one has enough knowledge to be a cynic. You just don't possess that much knowledge individually. We need to shift our heights a little higher because it's hard. And we don't get what we deserve, we get what we expect. We get what we expect. So I think the expectations in this room should be pretty high because I know what things we can do. And life's two most important questions are why or why not. And if you ask the question, why should we? You'll have a whole different outcome than why not go ahead and do this with a national strategy to be part of this plan, to be a full partner, and to do the things that we need to do and are capable of doing.